Hi there! You're watching Healing Words, brought to you by the Dolores Jean Lavin Center for Humanities and Medicine at Mayo Clinic. I'm Jackie Fletcher, and today we're going to talk with Dave DeBronkart. Since his cancer diagnosis in 2007, Dave has become a leading voice in patient engagement. He's diligently working to bring attention to the participatory medicine movement, which works to create greater collaboration between clinicians and patients. Dave is the author of 3 books that grew out of his posts he wrote on his Caring Bridge site during his cancer treatment and recovery, including Laugh, Sing, and Eat Like a Pig, Let's Let Patients Help, and Face Death with Hope. Welcome to Mayo Clinic, Dave. Thank you so much for being here today.
It's great to be here, thanks.
Well, so first of all, in 2007, you had some shoulder pain, and you went in for some routine checkups, and you got an x-ray, and your doctor said there's something in your lung. So what happened next?
Well, that's a sobering thing to hear. I mean, if you have no pain, to hear there's something wrong, basically, something in your lung that shouldn't be there. And so, my mind started racing, and I wasn't getting out of control, but I was thinking, he said, we don't know. This could be some fungal thing or a scar from some old infection, but we need to find out. And I said, I'd never had any news like this at all. Do I need to get back in there? I was ready to go jump in the car and race downtown. And he said, no, but I ordered a CAT scan, so call this number. And I made an appointment and went in, and what we found out was that the spot by my shoulder, this was total luck, the spot by my shoulder was one of 5 big tumors in both lungs, which turned out to be metastases from my kidney cancer.
Wow. Wow. And then you went down the rabbit hole. For the next year, you went through some very intense chemo and treatment.
Well, actually, the treatment I got, chemo doesn't work on kidney cancer, actually. Okay. So I got something called high-dose interleukin-2, which is an immune system treatment. It usually doesn't work, but when it does, about half the time, it's like, boom, you're all better. So I was diagnosed in January. The kidney came out in March. A really interesting thing for me was I was thinking this is like fire department emergency, do everything now. Yeah. My oncologist said, no, it's much more important to know what we're doing before we act. Mm-hmm. So the kidney came out in March. The interleukin treatment started in April and ended on July 23rd, and I haven't had a drop of anything since then.
Wow.
The best available data when I was diagnosed said median survival 24 weeks.
Wow.
So when we talk about facing death, I woke up at 1 o'clock that morning thinking, I remember looking at my ceiling in my bedroom thinking, what am I doing sleeping?
Wow.
It's over now.
Yeah. Well, and you started posting on Caring Bridge during this whole time. You were tracking what was going on. You were sharing this information with family members and friends. And when I was reading, and your first book is a collection of these posts, and when I was reading through it, I was so struck by how you managed your negative thinking. And I just wanted to read this quote from one of your posts. Any attachment to those feelings, so you were talking about the negative feelings you were having and the scary feelings, won't serve me in any way. They are my human experience, and they bring me no power. They don't leave me freed up to do whatever needs doing. It's miraculous that I can acknowledge them and let them go and become free to be effective. I was so struck by that. So why is it important for people to learn how to manage those, those feelings and those thoughts?
Well, especially, so what I'm going to say now, I couldn't produce literature citations for it, okay? But it's my subjective experience that a lot of other people have talked about. Health, the integrity of the body is a complex system thing. We know, one of the first things I thought about was Norman Cousins, the magazine editor in the 1960s, who believed that he was dying. He had some incurable stomach condition, and he thought as long as he was dying, he was going to go down laughing. So in those days, he rented a movie projector and watched Marx Brothers movies, and he laughed his butt off and got better.
Wow.
And a really important thing here, if you are in the crucible, the uncertainty, not knowing if you will be alive next year or in the next month or whatever, it's really important to not inadvertently make it worse than it already is by throwing yourself into a panic. Because what Norman Cousins demonstrated is one example of how we don't really know everything there is to know yet about how health works. If we did, we wouldn't need any more researchers. And to get back to your question, we now know that there is a field called PNI, psychoneuroimmunology. We know that the mood affects the nervous system, and the nervous system affects the immune system. We can't be certain, but there's good reason to think that that's what happened with Norman Cousins. And so what I was telling myself there was, I have choices, about how I spend my mind time, my mental energy. And I chose to think about it not in terms of worry, but like what could I think that would make any difference?
Wow. Well, I found it so empowering to read it. And what I loved is, you've got a title here too. I mean, there's humor throughout your book. It's so courageous and beautiful. And there are moments of real, I laughed out loud when I was reading it. And so the title, let's talk about the title a little bit. Where did that come from?
Well, so it's funny. I've always felt that, mind you, I am not somebody who never gets angry. I'm entirely capable of blowing up. So it's not like I'm some saintly person who always thinks beatific thoughts. But I thought, I thought about Norman Cousins, because, all the evidence was bad. There's just like nothing encouraging. But I also knew enough scientifically to know that there are always exceptions. And so somebody's got to be the 0.1%. So I was game to try that. So I said, I'm all right, I'll try laughing. Then I asked my physician. My hobby at the time was barbershop harmony singing, barbershop quartet singing. And I asked my doctor, I said, I'm getting really tired in the evening. Should I stop going to rehearsals? And he said something incredible. He said, absolutely not. You don't want to stop life activities that you love. Because it sends your system the wrong message that you're shutting down. So I said to my friends, all right, so now my prescription is laugh and sing. It could be worse. And then they said, all right, dude, you're losing weight. You got to stop that. All right. So they sent me this this diet that was titled "How to Increase Your Caloric Intake." And
how fabulous!
I know. Well, it said put real whipped cream on all desserts, have heavy cheese pizza for snacks.
Oh my goodness.
No low-fat anything, real butter on everything.
Yeah.
So I said, now it's laugh, sing, and eat like a pig. And if I get out of this alive, I'll write a book. And that's what I'll call it. And I did.
And here you are.
I know.
Oh, that's fabulous. Thank you. Thank you for telling us the background on that.
There's something important there.
Yeah.
When I'm exhibiting that mood, people don't come in and act like I'm dying. Right, so in a sense, I'm creating a different atmosphere around the conversations I have with my family and friends.
Wow, and that's a big deal. That's
Well,
a really
sure.
big deal.
If everybody who walks in looks like they're about to burst out crying, and wondering when your funeral's going to be, and there's a time for that.
Yeah.
But it's not how you have to spend your life.
Yeah, because you were still going through all of the treatments and trying to work through the...
I was diagnosed in January.
Yeah.
It wasn't until actually June that we got any evidence that things were getting better.
Wow, and you talk a little bit about this too, but that waiting period and the uncertainty of that, and you did a section in your book about how therapeutic the blogging was for you and that it can be for people, and there's,
Yes.
we talk a lot about that on this show, about how writing can be used as a healing tool. beneficial. And I'm hoping you can talk a little bit about, the therapeutic benefit you found in just the writing itself.
Sure. Well, I'm no therapist, okay? So I speak only from my personal experience. But I have a very strong personal sense over the course of my life that when there is some unresolved thing that wants to get expressed, it's like congestion in my soul. It really is. And I mean, to be perfectly honest, at one point I wrote something somewhere, I don't think it was in the book, about my soul needed to blow its nose. I just needed to clear this out so that I could breathe more easily. And the process of taking a vague feeling and converting it into a stream of words, right, for me was useful. And I also, but then once I was on CaringBridge, I knew that people would be reading it. So I also knew that I was expressing what I was thinking, but I was also beginning a conversation with people. And there's one thing that was very liberating about that. I worked in communication technology and IT a lot in my life, and there's this concept of synchronous communication, which is when you're on the phone with somebody talking at the same time. But then there's asynchronous, which is more like sending an email, where I just put something out there and it's very convenient for the other person to read it at their convenience. And then I can read what they send back to me.
Yeah. Well, and what's really wonderful about that is that, you get to connect with people all over the world, really, in theory, and your entire community. And there was this reader from your site that you quoted in your book. I've learned that to go through something this hard alone is not noble. We have to give of ourselves completely to be open enough to receive all that comes back to us. Hoofta. So, you're helping other people as well through their journeys when you're doing this kind of writing, not only your own.
But that's what we do in community.
Right.
Right?
Yes.
We help each other through things.
Yeah.
And that was a woman I hadn't seen for 20 years.
Wow.
And when you're facing the question of, is the universe done with me? And people start coming out of the woodwork and cheering for you. And there still was no guarantee, but at least I had a sense that if I was going down, I was reconnecting with people.
Yeah. Yeah.
And to feel complete.
Wow.
Is terrific. I want to say one other thing about this. One of the first things, joining a patient community is profoundly useful and effective in ways that will never show up in a medical textbook. One of the first things, when I looked at the literature about my disease, I got all kinds of facts and no soul at all, no heart, nothing that in any way said, I know how you're feeling.
Yeah.
But that's exactly what I got from the other patients. We could frankly discuss, how likely is it that I'm dying now?
Yeah.
And the people, because they'd been in that situation, were able to, either offer more information or pull back, depending on how the conversation was going. They said, welcome to the club that nobody wants to belong to. But we've been there. And another important thing they said, they taught me things I sort of knew about statistics from school. They said, just remember, all published 5-year survival data is 7 years out of date compared to how medicine is practiced today.
Wow.
Because in 2000 they did a study, they watched survival for 5 years, and then it takes a couple years for it to get published. And in fact, the reality at my hospital was that they were had significantly better outcomes than what was in the literature.
Wow. So. Yeah, because you turned to online groups of patients because your doctor suggested that. Is that right?
Yes.
Yeah.
This was my primary physician actually knew about this community.
Yeah.
We don't have enough good, high-quality patient communities for different diseases yet, but I'm sure that as time goes by, we will.
Well, and this is what I found really interesting, because as you dove into this experience of connecting with people online and using this community of folks who were really looking at research and looking at all of the different things associated with what you were going through, I mean, you kind of discovered this whole other world, which has led to a new career for you. And so I would love to hear, because you call yourself E-Patient Dave.
Mm-hmm.
So what does the E-Patient mean?
So it means empowered, engaged, equipped, enabled. Some people say educated, about evidence, or expert. And when the term was first invented back in the 90s, it was about being online, like everything. In those days, any patient, when the internet, when the web was brand new, any patient who was online was necessarily empowered and engaged. These days, all kinds of disempowered idiots are also online. So I'm talking about being empowered.
Yeah, yeah.
And I want to say something about what empowered is, too.
Sure.
As a child of the 60s, I learned long ago, an empowered person is somebody who never says, well, there's nothing I can do, because that's the expression of being powerless. Right? That's disempowered. An empowered person looks at the situation, and no matter how bad it is, will be thinking, what can I do? And engaged is like we're engaged here, as opposed to some people treat healthcare like they're a car in a car wash. They roll up the windows and they get stuff sprayed on them, and then they go out to lunch.
Yeah.
Where an engaged person is talking with the nurses, the doctors, asking, what about this, what about that?
Yeah.
And so, after I went through this whole year of treatment, and then a year later, my primary physician, Danny Sands, introduced me to this e-patient movement that he's been part of since the 90s. Then I wanted to strangle him. I said, how could we have gone through this whole year and you never tell me about this e-patient stuff?
Yeah.
Because it's what I was doing. And one thing led to another. A year after that, I wrote a blog post about garbage in my medical record, and the Boston Globe put it on the front page.
Wow.
And that was 2 weeks before a conference where somebody took a picture of me in the balcony of the conference room, and a month later, I was in Washington at policy meetings.
Wow. Well, I am not surprised by any of that, first of all, after reading all of your work, because what I loved about it is, first of all, you were an empowered, engaged patient from the beginning. I mean, you kind of came to that naturally, and so I'm not surprised at all that then you found this community.
Just being a child of the 60s.
Yeah, it's wonderful. And so even if people are not facing a medical crisis, I mean, it's really a manual about how to live as an empowered, engaged person, which I love about your work. The other thing that I found really interesting is that by doing all of this work, by being empowered, by being engaged and inspiring, and then to use humor to talk about it, not only do you set the stage when you're in the hospital room and create an environment, but you also are then able to go out and talk to clinicians and physicians and healthcare providers and have conversations about things that people don't necessarily want to talk about because they're a little uncomfortable. So I just love what you're doing, that you really are advocating collaboration on this on a medical journey for anyone, because we're all going to be patients. We all are patients from at certain points in our lives. And so thank you so much for doing that. A question, since you're touring and speaking around the country, what have you seen in healthcare that you're really excited about, that you think is going in the right direction?
So there's one thing that's very important but is not going well yet, generally, which is computerizing the medical records. There are so many problems that happen because a new doctor that you go to can't see all your information. And so federal policy has mandated pretty much that if people want to get full reimbursement, they got to get a computer system. Unfortunately, a lot of the systems that people have been able to buy have not been really usable. Important tip for everybody there: when you are working with a doctor or a nurse and they're with the computer, ask them to turn the screen so you can both look at it together. You want a triangle between the three of you. Sometimes it's not uncommon for people to make a typo when the information goes in, and that means the next doctor might do the wrong thing. So that's what I'm telling the people who use those systems is, you got to go beat on the software vendors to make the systems easier to use now.
Yeah.
The other big thing is that this whole field that we call patient engagement, right? And there's a cousin, it's not the same thing, but patient experience. People are finally realizing that it is not enough to just save my life. It makes a difference if I have a good time, and I don't mean like entertainment, but things that are unnecessarily stressful or annoying. And we're even at the point now where the British Medical Journal, one of the best journals in the world, now when authors go to upload a scientific paper saying, please, please, I really want to get published, they get asked, how did you involve patients in defining your research questions?
Wow.
All right, so the culture of medicine really is shifting. Well, just the fact that the Mayo Clinic invited me, the chief medical residence, invited me to be a visiting professor here this week. I mean, it's crazy, except people are starting to see, highly trained people are starting to see, that everything looks different if you look at it from the patient's perspective.
Yeah. Yeah.
Even the Institute of Medicine, which is like the top of academic medicine in America, maybe in the world, published a report in 2012 that said that the healthcare system of the future, one of the 4 cornerstones is patient-clinician partnerships. And under that, they explicitly said engaged, empowered patients.
Wow. And you are certainly one of those.
It's what I'm doing.
Wow. Well, thank you so much. It's just been such a pleasure to talk to you today. I'm hoping that, one of the things we talked about earlier was that we use writing on this show as a
Yes.
therapeutic thing for folks here at Mayo Clinic. And I would love it if you would give us a writing prompt for an exercise that people can try while they're here.
So this is something that for me was profound. It ties into what we discussed earlier about my relationship to being sick and health as a matter of bodily integrity. I have a sister who's a jazz singer. Her stage name is Suede, and she worked with a lot of people during the HIV/AIDS crisis in the 1980s, has been through many people through the transition of dying, and she advised me so wisely. Please, 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 I hope people will stay away from talking about their battle with cancer. There's so many people who talk about it as a brave confrontation. I'm going to go get this thing. And it's popular in the media. Even there's a famous metastatic breast cancer patient named Lisa Adams who explicitly said in all of her extensive blogging during her disease, do not say that I battled cancer. You know what the New York Times put in its headline about her obituary? That she battled cancer. Stop it, stop it, stop it. What my sister taught me, she said, consider this. Who grew this thing? This is not a bacterial infection that came in from outside. This is something in my kidney. This is something I grew. Now, I don't know how that happened. I don't know what the condition between mind and body is. But the question she asked was, and this is no guarantee that anything's going to produce a miracle. The question she asked was, do you want to set yourself up as mentally attacking something that you were part of creating? And so how about if you write a letter or an email to your disease? Have a talk with it. Who knows? Maybe someday we'll understand that these things have a soul at some level or some way of being. Maybe it's fighting for its survival. I don't know.
Yeah.
But what that let me do, I no longer felt like I was in a battle with some invisible external force.
Yeah.
And it's funny. My daughter said, well, let's come up with a name for it. And so we came up with some. Since it was renal cell carcinoma, she proposed Reenie. My mother, though, she was the classic. She suggested Sylvester and Tweety, so that you could just go like Sylvester is always doing.
I love that.
Well, and it's funny, one thing that was a real stress inducer for me when I was sick was, lying in bed at night trying to fall asleep, just scared to death. And what I learned was that there was a place I could go in my mind where I'd just be lying there with the lights out, and I would say, Good night, Cancer. I know you'll be there tomorrow. And with that, I was able to get rest, which certainly helped.
Wow. I think that is a beautiful exercise. So writing a letter or an email to your condition, whatever that may be.
Right.
I love that. Well, and let's talk. I would love it if you would do a reading for us, because in your book you also talk about radical acceptance. You talk about hope. I would love to have you do a reading for us. Would you?
Of course.
Thank you.
Before the story starts, I want to lay the emotional foundation. First, I looked death squarely in the eye. Then, regardless of the odds, I chose hope. People who faced imminent death share a certain awareness. If you've just joined our ranks, welcome. You should know some of us live through it and some don't. You will be one or the other. In my most desperate moments, one question gripped my mind. What can be said that will make any difference? Because there really is no point saying anything else. I vividly recall realizing it was over. In my speeches, I talk about realizing I'd never see my daughter's children, and they'd never know me. I talk about lying awake that January night, realizing my memorial service might be a few months away. Would it be May? September? What would the weather be like that day as people gathered? My father's memorial service was fresh in my mind, so my thoughts were vivid. What would my mom's face look like as she said goodbye to her son? I'd had some preparation for this moment. In my 40s, for some reason, I took an interest in aging and death. In the town library, I'd found recordings of Harvard psychologist Richard Alpert, who'd been an associate of Timothy Leary. Alpert went to Tibet, found a guru, and took the Sanskrit name Ramdas, servant of God. In his talk, Approaching Death, he cited a tombstone inscribed, "As I am now, so you will be. Prepare yourself to follow me." He talked about ministering to many people as they went through this final transition during the AIDS epidemic, and more years working in hospice. Somehow his words rang with wisdom for me as he combined the perspectives of Harvard, ancient Egyptian scriptures, and modern practices of Tibetan monks, often expressing them with the humor of a New England Jew. Well, my sister, whose name is Swade, was a similar influence closer to home. Like Ramdas, she had worked with HIV/AIDS patients during their final passages. Her first album includes the deeply moving song, "The Ones Who Aren't Here," which was written during the AIDS epidemic. Everyone deals with this differently, she told me. There's no right way. Don't spend any energy telling yourself, I shouldn't feel this way. When I realized I was in that state, their words came to mind. Death soon was so real that I asked my doctor what it would feel like at the end. He thought I meant pain, so he assured me I'd be kept comfortable. I said, no, I was thinking about the passage itself. What will it be like at the end? Will my lungs shut down so I'll be short of breath, or something else? I was prepared to let my experience be my experience, expecting nothing with nothing wrong. My feelings would be whatever they were, and I would stay mindful. Terry Wilson, a member of my ACOR kidney cancer group, told me of radical acceptance, a concept discussed by Dr. Marsha Linehan. It combines Western cognitive behavioral techniques, like altering how we look at things, with Eastern practices for mindfulness, distress tolerance, and acceptance. Radical means complete and absolute, and that's the space I found myself in. All right, this is what's so, let's get to work. Acceptance of one's situation, seeing it as it is, doesn't mean giving up. To the contrary, it gives one a firm place to stand, attached to reality, with no energy-sapping resistance. In that space, here's the point of view I came to. First, am I dying? Yes. Ramdas quotes someone who said, "Being born is like setting sail on a ship whose purpose is to go out in the ocean and sink." Sooner or later, I'm dying. Am I dying now of this cancer? Nobody knows. You can learn about the odds more or less, but odds apply to large populations, not individuals. Next thing was taught to me by my patient community. I won't die of cancer if I live long enough for something else to get me. My patient community quickly taught me that the game is to live long enough for something else to get you first. If you get hit by a bus, you didn't die of cancer. It might seem crazy, but think about it. If you feel trapped, like you can't escape, it helps to know it might not get you. If you live long enough for a cure to be developed, the cancer didn't kill you. You might live long enough for a new treatment to come along that makes it a chronic condition, not fatal. Yes, there are some cancers that are now managed as chronic conditions, not fatal. And it's not unusual for an autopsy to discover a cancer that nobody knew was there. They died of something else. The cancer didn't kill them. Now, another way of looking at this, I had some warnings. Some people don't. I learned that 1,200 people wake up every day in the US and get dressed, not realizing it was the last time they were putting their socks on. By midnight, they'd fall to sudden cardiac death. They had no chance to think things out, prepare, respond. I at least had a warning, a chance to get it in gear. And then finally, you might get better for no apparent reason. It happens. A small percentage of all cancers disappear spontaneously, and science doesn't know why. It is not scientific to say there's no chance of this. I wouldn't bet my house on it, of course, but my mind was open to the possibility. And another thing the patient community taught me is until I'm 100% dead, I'm 100% alive every day. Enjoy it. Finally, at a Christmas party in 2008, a year after my cancer, I bumped into a kidney cancer specialist from another hospital, a marvelous grandfatherly Greek physician. We talked about hope, and he said he's changed his answer when patients ask if they will get better. He used to say, based on his training, that it's not likely, and he'd watch the life go out of them. Now I tell them, he said, I don't know, but we will try. Will you work with me, he said. And he adds, what more could you ask for, right? The odds are bad, but let's go for it. And he adds to the patient, just one thing, if we succeed, you must drive carefully. We don't want to save you and have it wasted. I'd say game on. You don't have to survive, You may decide you've had enough. That's your right. You may decide now is your time and you choose to let go. Or you can choose to try everything. Or you can choose to try until you've had enough. To me, the question is, do you have something worth living for? A future worth living to see? If so, let's get to work. And for me, the most magnificent blessing is that a year after this book was published, I did get to walk my daughter down the aisle. And a year and a half ago, I got to meet Zoe Grace, my granddaughter. Please, whatever your situation, be the most whole, complete person you can through this experience. Nobody knows how it will end, but please be fully alive every minute you have.
We talked earlier about some of the therapeutic benefits of blogging, so let's try an experiment. What would you write about if you started your own blog? Or what topic can you write about if you already have one? Blog posts can be a sentence long, a paragraph, or an entire 3,000-word article if you want them to be. So let's start writing a post today. First, let's brainstorm ideas for things you can write about. Here are a few prompts to get you started. Number 1, what message would you want to share with the world? Number 2, what feelings do you want to write down so you can get them out of your head? Number 3, what empowering note do you want to write that will help your own heart when you reread it? Number 4, you could write about the people who have shown up to support you during your life and how you feel about them. And number 5, you can track your medical journey and what you've learned from it so far. please take a moment to write, even if it's only 5 or 10 minutes. I recently worked with a woman who tried a very simple, easy writing exercise like this one. And afterwards, she absolutely glowed. She said, "You tricked me. You got me to write by easing me into it. And now I know I can do it." Well, guess what? You can do it too. And it can make you feel inspired and excited like the woman I worked with. Thank you so much for watching Healing Words, brought to you by the Dolores Jean Lavin Center for Humanities and Medicine at Mayo Clinic. I'm Jackie Fletcher. If you'd like to try some of the exercises you've heard today, you can ask your nurse to contact us and we'll get you a notebook and a pen. You can reach me with any thoughts or suggestions or arrange to have a writer visit you in your room by using the contact information on the screen. I hope you'll visit ePatient Dave's website at epatientdave.com and read his important work to learn more about how you can be a more empowered patient or caregiver. Until next time, be well.